committee prior to the consideration of the rule for the American Health Care Act for policies that do not incentivize new Medicaid enrollment.
Mr. Gaetz is recognized for a total of 10 minutes with 1 minute reserved to close.
Thank you, Madam Chair. Incentivizing growth in the Medicaid program is fiscally irresponsible, it's inconsistent with free market principles, and it should not be reflected in this legislation. Obamacare, in its essence, is simply a redesign of the Medicaid program. In many ways, Obamacare is inappropriately named. It's better named as Obamacade because more than 60% of those who are purported to be covered are covered through Medicaid expansion. And Medicaid has exploded under Obamacare. 1 in 4 Americans is now on Medicaid. And so what is the consequence of Medicaid explosion? It's certainly not better health care. Researchers at the University of Virginia reviewed the experiences of nearly 1 million patients undergoing 8 different types of surgical procedures. They found that Medicaid patients were twice as likely as patients with private insurance to die as a consequence of their hospital surgery. Medicaid patients who are hospitalized under current circumstances cited above are 13% more likely to die than patients who have no insurance at all. Hospital stays are 42% longer. And in the state of Oregon, where perhaps the most robust research was done, there was 0 evidence that having Medicaid coverage yielded any better health care outcomes. The data that I've cited makes very clear that the wish sandwich is Medicaid. We also haven't seen ER visits decrease as a function of Medicaid. A recent of the American College of ER Physicians notes that following Medicaid expansion in Medicaid expansion states, ER visits have actually increased. And certainly, we have not seen better access to health care. Look no further than the state of California, where they went from more than 8 million people on their Medicaid product to more than 12 million people on their Medicaid product. They couldn't raise taxes fast enough to cover all of the folks that were on Medicaid. So what did they do? They cut reimbursement rates to providers. And when that happened, providers left the market. And when providers left the market and people couldn't get health care, they ended up right back in the emergency room. And so Medicaid expansion in many ways is a cruel joke. It gives people a card that tells folks they have health insurance coverage, when in reality, access is frequently illusory. But it's not just California. In Colorado, it was nursing homes that saw reductions in reimbursement rates. Think how irresponsible that is, thinning the soup in our nursing homes as a consequence of these flawed liberal policies. In Illinois, reimbursement rates were cut to hospitals and for prescription drugs. They were limited to only 4 a month. That is rationed care. In Louisiana, primary care was cut, dental care was cut, mental health care was cut, dialysis centers saw a reduction in reimbursement rates. In Maryland, nursing homes and hospitals were the victims. In New Hampshire, hospitals saw rationed care and reductions in reimbursements to the tune of $160 million. In the last motion, Democrats demonized rationed care. But it's their policies that have doubled down on ration care. Because when we overload a Medicaid system that was intended for the vulnerable, with able-bodied childless adults, you do no service to the vulnerable, and ultimately, you don't yield better health care outcomes for anyone. When we promise Medicaid to people, I often think of the story of Diamante Driver. He was 12 years old. He thought he was going to get more than a wish sandwich. He thought Medicaid and be covered. Diamante Driver had a tooth abscess. And because the Medicaid program was so overtaxed, so stressed, he couldn't get in to see physicians. He had such long waits that this 12-year-old boy died on Medicaid because we were not taking care of this vulnerable population. It's morally wrong and financially irresponsible to continue to tax this system irresponsibly. Now, some states expanded Medicaid. That's a reality we have to deal with. And I am modestly sympathetic to the arguments made by my colleagues that in expansion states, there ought to be a glide path so that we can adjust to various market forces. But the policies that affect current enrollees shouldn't necessarily spill over to new enrollment. That is what my motion deals with. And so if the organizing principle of this bill is that people are better off with tax credits and control of their own health care than they are on Medicaid, it seems ludicrous to spend the next 2.5 years plussing up the Medicaid rolls by allowing additional states to expand Medicaid and by allowing existing expansion states to be able to add new enrollees to that Medicaid program. The provisions of this bill that embrace Medicaid expansion for 2.5 more years are illogical. If our goal is to have fewer people on Medicaid, let's not start by putting more people on Medicaid for 2.5 years. This would be like a diet strategy. If I said that I needed to lose weight, but I would go on a diet 2.5 years from now, and up until that point, eat everything in sight. It makes no sense. The gentlelady from Texas mentioned earlier that this was a plan to bust Medicaid. It is not. It is a plan to save Medicaid for children, for the disabled, for the vulnerable, for people like my mother, who've been in a wheelchair for 31 years. I think every day when we talk about health care about how like my mother would be affected, who are constrained and require additional assistance. The way to save Medicaid is not to explode it, not to put people into Medicaid that don't belong there. We should pass amendments consistent with this motion. We should similarly pass amendments consistent with Mr. Westerman's motion, allowing flexibility to be able to direct resources to those who are truly in need. And Madam Chair, I would yield to Mr. Arrington such time that he may